Welcome to the Marshall County Board of Supervisors regular session, September 10th, 9 a.m. in the first floor meeting room here at our courthouse. Notice to the public, the Board of Supervisors welcomes comments from the public during the time allowed for discussion. You are requested to approach the podium, which now is on this side, and use the microphone, state your name and address for the record, and limit the time used to present your remarks in order that others may be given an opportunity to speak. The normal process on any agenda item is for the chair to read the item from the agenda. The board is given an opportunity to comment on the issue and/or place a motion on the floor. An opportunity for discussion may be presented, at which time the public may participate and a roll call vote will follow. Roll call, please.
Hibbs.
Yes?
Heil.
Yes.
Goodman.
Yes.
If you would please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I would entertain a motion regarding the agenda.
Make a motion to amend the agenda to move item number 7 to following number 5 service awards.
I'll second that.
Okay. Roll call vote, please.
Goodman.
Yes.
Hibbs.
Yes?
Heil.
Yes.
Okay. Item number 5, service award. Nicole. So we're recognizing Nicole Malloy. And Jordan, would you like to speak to that, please?
Absolutely. Jordan Gaffney, Marshall County Attorney. So today we get to celebrate 15 years that Nicole has been with our office. And Nicole is dependable, she's hardworking, and she does great work. And I think you would be hard-pressed to find anybody who's more kind than Nicole Malloy. We're very, very thankful for all the service you've given to the people of Marshall County and this office, and very thankful that you're willing to be a leader in our office and someone that folks will look up to. So thank you very much, Nicole. Today we get to celebrate you.
Would you like to speak, Nicole? No. Okay, we'll let her. Okay.
They never do that.
Thank you for your service.
Thank you, Nicole.
Thank you.
All right. We will now move item number 7, which is public health update. And so we have Sydney Grewell and some additional guests here with us today. So Sydney, would you like to come up and introduce your guests, or have them introduce themselves? And then we'll hear from you.
Yeah. Sydney Grewell, Marshall County Public Health Director.
Hi, I'm Matt Donahue. I'm an internal medicine physician and state epidemiologist with HHS at the state.
Okay. And so Sydney is providing us an update on what's happening with the Legionnaires outbreak in Marshall County. So Sydney, I'll let you go. Because this is a Board of Supervisors regular meeting, the board will address Sydney, and then we can open it up for a few questions after that. Okay?
Yeah, so I'm going to pass it to Dr. Donahue to give an overview of Legionnaire's disease and provide some of the state background, and then I'll follow up after that. So go ahead.
Happy to. Thank you, Sydney. It's a pleasure to be here with you all this morning. I got to say before I get started, I feel like I partly grew up in Marshalltown. So I'm from Adel, Perry, Iowa, just west of Des Moines, but my grandparents lived here for all their life. And before I leave today, I'm going to have to get a tailor's made right, because I have not had one in ages, and I can't wait to get another one. So I feel a special connection to Marshalltown. So I was thankful to be able to come up here with you all today and say hi in person. Some of my background is I'm an internal medicine physician, and since doing internal medicine, I've worked for different state agencies, worked in Nebraska, Was thankful to be able to come home to Iowa about a year ago now. And my work with the state at HHS involves infectious diseases, communicable diseases, and things like Legionella. So Sydney mentioned you had a meeting today and wanted to take the opportunity to come up and talk about Legionella. Have some notes. I'd like to do maybe about 5 minutes if I can to talk about what Legionella is and what's been happening around the outbreak so far. So Legionella is a bacteria. It's not a virus. It's a bacteria that's normally found in the environment. It's normally found in freshwater environments, things like ponds, lakes, rivers. It might be found in soil. It can be found in your garden. Normally, when it's in those places, it doesn't cause a problem. But it really, really likes warm water. And Legionella can grow to higher levels when it finds warm water in a man-made system. Something like a cooling tower, something like a water fountain, or something like a hot tub. It's one of the main reasons we disinfect hot tubs. Cooling towers, we talk a lot about when we talk about Legionella. And it's kind of a term that most people aren't familiar with. You don't really have a cooling tower for your house. It's really an industrial application. It's something that's used for buildings that have a lot of warm water. So buildings that might have a big air conditioning system might use a cooling tower to remove heat from that air conditioning system and then cool water at the very top of that building. So a cooling tower specifically will bring hot water from that building up, and it'll use evaporation to get rid of that hot water. Now, evaporation works to cool that water just like sweat works to cool your body. But if Legionella has found its way into that system, into that warm water, it can multiply to high levels, and then that evaporation can spread that Legionella in the air. That's what a cooling tower is, that's what it does, and that's how it's relevant to Legionella. And we know that some outbreaks in the past have occurred from Legionella that multiplied to high levels in cooling towers. And then that water evaporated and it spread in a small area, kind of like Marshalltown. That's Legionella and that's a cooling tower. Now, that's all important because, as you know, the Legionella bacteria can cause a severe pneumonia in people. And that pneumonia is very treatable. We have antibiotics that work really well to get rid of it. And those antibiotics work well the vast majority of the time when someone has a Legionella pneumonia, but it's capable of causing severe disease in some. Now, because Legionella is everywhere, like in freshwater environments and soil in your garden, most people who are exposed to it don't get sick at all. And it's likely all of us in this room have been exposed to Legionella at some point. But there are some people who will get exposed and then get a lot sicker. And that's generally people who are older or who have smoked or have other medical conditions. So some people are more susceptible to severe illness from Legionella. So one main message that I think we've talked about already has been that anybody in the Marshalltown area who gets sick with a pneumonia-like symptom with a respiratory illness should talk to their doc about Legionella. It's something we can test for really easy. It's something that's very treatable with antibiotics, and that's been a core message we've hoped to get across. So what about background and what we normally see around Legionella in Iowa? So this isn't something that's extremely rare. We'll see between 30 to 90 cases of Legionella each year in Iowa. It's something that we work on a regular basis. And most of those aren't tied to outbreaks. Most of those are someone can pick up Legionella from the environment, and for one reason or another, their body didn't fight it off that time. And they got sick. And they went and got a test, proved it was Legionella. For Marshalltown so far, we found 34 cases and 1 death that we believe are tied into and associated with a single outbreak here in Marshalltown. In public health, what we do for each case of Legionella, when we have a lab report that comes into us, we call that patient. We figure out, where all have you been? Where might you have picked this up? Did you go travel to New York? Were you staying in a hotel? Or did you stay in Marshalltown? And is it possible you picked this up here? We do that to figure out how an outbreak might have started and then where we might be able to intervene to help stop an outbreak. That's exactly what's been happening with Sydney and with the state team since this originally kicked off. So as soon as a cluster of Legionella cases was identified here, that investigation started, we released a bunch of messages to clinicians in the area. We released a HAN, that's a Health Alert Network advisory, that says, hey, docs, Legionella is something you need to be looking for in your patients. We believe there's an outbreak here. Immediately following that, we also sent out a press release to let the public know, hey, if you have respiratory symptoms, things like a pneumonia, you need to think about Legionella so you can get the appropriate treatment. Local health department, Sydney. The team at the state, CADE, the Center for Acute Disease Epidemiology, both of us have been in constant contact, and we've been in contact with CDC, who's helped layer on additional ideas for us to think about. Since it kicked off, we've all been working as a team to try to figure out how this was happening in Marshalltown. That's the investigation, and that's the point we are at now, too. We're trying to figure out exactly how people are getting sick with Legionella here. So we don't have all the answers yet, but we are starting to hone in on a top hypothesis, the top theory. It doesn't look like this is coming from a hotel. It doesn't look like it's coming from a water fountain. It doesn't look like it's coming from a hot tub. It's most likely coming from a cooling tower. That's what we're honing in on. And we don't have a smoking gun. We might not find a smoking gun that tells us this is exactly how this happened. But because of how wide it appears to be spread, because of the calls we've made to patients so far, that seems like the most likely answer to how this has all started. So we're honing in on cooling towers. What we've done with cooling towers so far is we've tested 9 of the most likely cooling towers that we think could be responsible. And again, because of the nature of Legionella, we might not find an answer in those tests. The test to find Legionella is kind of like a strep throat culture. You might go to the doc with a sore throat for, the doc will say in a few days, he'll call you with the results of the culture. Legionella is even harder to culture, so it takes even more time than strep for that test result to come back. We're hoping we can find an answer in that testing, but it's very possible that we won't. So in the meantime, what we're doing is for each of those cooling towers that we think could be the reason why Legionella is spreading, we're asking them to disinfect the whole thing, even before we have an answer. If we disinfect those cooling towers, that should kill the Legionella in it, and that should decrease the risk of it spreading through the air to other people. We've got 9 tests that are pending now from 9 different businesses with cooling towers, and I know 4 of them, as of this morning, had completed that disinfection. And we're confident the remainder will as well. So that's forward progress. Even if we don't have a smoking gun, we're disinfecting the most likely sources while we're waiting for those test results. So, guys, the main points are really Sydney, us at the state, CDC, we've been working together as one team to try to figure out what has caused this outbreak in Marshalltown. We don't have a smoking gun yet. We might not get one, but we're making sure that all the top targets are addressed as we continue looking. And I'm going to hope that we get an answer from them, but I'm going to know that we might not, and I'm going to make sure we're disinfecting cooling towers in the meantime. And those cooling towers are being disinfected now, and we're working to make sure that each one that might be responsible finishes that disinfection. And I think the message for general public is, if you're in Marshalltown now, you have a cough and fever, shortness of breath, you think you might have a respiratory infection or a pneumonia, to talk to your doc and tell them about Legionella. We think that they all have the message, but it'd be extra important to flag that for them so that they can order the right tests and get you on the right treatment. And that's all I have. Thank you for the time and speaking.
So just a couple of questions I have, and then I'll see if Jared or Kevin have some questions. Can you remind us then of the timeline for the kind of the time that you actually started and became aware of it to where we are now?
Absolutely.
And you've talked about the testing and the culturing and, kind of what's happening, but talk a little bit about the timeline.
Happy to.
Yeah.
So the first Legionella cases were reported to us on Sunday, August 24th.
Okay.
So that next week, what happens is intensive investigation. That requires a phone call to each patient and then a detailed review of, hey, Where have you been? Did you go to New York City? Were you in a hot tub? Were you playing around a decorative fountain or not? The first cases were reported to us on Sunday, the 24th. And then that following week, more cases trickled in. Throughout that week, we realized we're seeing more cases reported than what's typical. And we prioritized investigations and calling each one of those patients to try to figure out if it was something happening in Marshalltown or not. I know as we were looking, Sydney was in contact with local docs to say, hey, we're picking up some Legionella cases, make sure you're testing for it. And it was by the beginning of next week, we had enough cases, this is the first week of September, we had enough cases and we had enough investigations and calls completed, enough folks picked up the phone for us, where we thought this is happening in Marshalltown. And it was that week that we put a HON out formally on Wednesday, and then the press release formally on Thursday.
Okay.
So that's the thing that I think the timeline that people are unsure of is it's a normal procedure for people to report the Legionella. And we got a few cases, which is, as Dr. Donahue said, not uncommon for us to see. I've been telling people it's just like we get E. coli. They have to report that to us, just like any other STIs as well. We don't notify the public of every time somebody tests positive for something. There's things that are done on the back end, and it's usually me calling the patients. They have to pick up the phone, which is sometimes difficult, especially if you have a number that you're not used to. We complete those interviews. Each one of them has a different set, again, asking where you've been, what you've eaten, have you traveled, all those different things. Each one of them is specific to each communicable disease that we see. So again, we were in communication at that point, and the state sees that on their end as well. And again, on that Wednesday, because we were kind of thinking we've seen some numbers, those providers were notified, hey, be looking maybe for Legionella, and start treating those patients if you see them.
We appreciate the information. And
I think one last thing, the timeline here, I think worked really, really well. The docs reported the cases in the right manner and the right timeline. The investigations happened and folks picked up for us to give us that information in the right time frame. And as soon as we were able to make a conclusion that there was a cluster here, and it was Marshalltown and not from travelers going elsewhere, that was sent out in the HON and the press release. And I think this was the system working exactly as it should. And I don't know if it would have been possible to have done anything earlier. From a number of outbreaks I've worked on, Sydney and the local team, the local docs, and even the help with investigations from HHS went as quickly as I could have expected.
Yeah, I know they've been working closely together, and so we appreciate that. And we appreciate the partnership between the local docs and public health here and Sydney's attention to it. So can you talk a little bit about person-to-person transmission and what if that's possible, what does that look like?
Happy to. With Legionella, you really get Legionella from water droplets in the air, from one of these water systems that has warm water in it and is spraying it into the air. There is no person-to-person transmission of Legionella. So this is something that is strictly from water droplets in the air to people.
Okay. So if you're exposed to an infected person, you're not necessarily at risk
Correct.
to get it?
Correct.
Okay.
Nor can you get it from drinking the water as well, which has been, from Legionella experts that I've also spoken to, said it's not going to it may upset your stomach like, somebody who has an intolerance to either dairy or garlic that upsets your stomach, but it's not going to cause these serious infections.
Yeah, that's a good point. You don't get Legionella from drinking water.
Right. And I think it was helpful to have the Waterworks manager speak to the public the other night at the city council meeting. So Jared or Kevin, do you have questions or comments you want to make?
Well, I just know in some of the Facebook comments, there's people who are concerned about getting it through the CPAP machines, but obviously, with your presentation here, that's next to impossible.
CPAP?
Just because the water source is from your tap water, if you're not using distilled water.
You don't get Legionella from drinking water. You get it when water's heated up and then sprayed.
Okay.
With CPAP, that's an item that you need to make sure you're disinfecting appropriately per the instructions that come with it.
Okay.
If you're doing that, the risk of Legionella is low.
Okay, so there is some concern possibly.
Any device that heats water and sprays it or humidifies it could be a risk for Legionella, and that's why it's important to disinfect them.
Okay,
Which is one of those questions asked on those investigation sheets. Do you use a humidifier? Do you use a CPAP? Do you use a BiPAP? Where do you get the water from? Where did you buy the water from? Do you clean it? All those questions are asked, which is, as we started the investigations with those few patients, was it somebody negligent of just didn't clean their machine properly? Did they, get their humidifier out from the winter and just used it this summer because they weren't feeling good? Questions like that, so that we ask them.
Thanks for being here today. So we talked about the water droplets in the air that have Legionella in it. Based on, I think, as of today, up to 34 cases.
Correct.
Are you able to determine if there's the possibility of this still in the atmosphere right now in Marshalltown, or do we not know at this point?
Testing the air isn't something that produces results. The best we can do is to test the water from those cooling towers. I won't be able to tell if it's in the air, but what I can tell is if it's growing from those samples we collected. And the main point is, if it's possible that it came from these places, we need to begin disinfection straight away. And that's what we're asking them.
And so the new cases that came out yesterday, we're not able to determine if these are new, getting it now, or if these got it previously in that same time frame of when all these other cases came in.
Correct. So Legionella can take anywhere between 2 and 14 days from when you're exposed to when you start getting sick. So any cases that show up now that get sick and go to a hospital and get a test, they could have been exposed as long as 14 days ago.
Okay.
It's also what we use to help determine when we think we're in a safe space is when we stop seeing them for 14 days. If we're not seeing new cases pop up after 14 days, then we think the outbreak has now been brought under control and we might have disinfected the right tower.
And with that said, how can you reassure the public that it's safe here in Marshalltown? I know I've heard people say, I don't know if I want to visit Marshalltown right now because of this. What can you share on that?
Most people who get exposed to Legionella don't get sick. And most of us are exposed to Legionella every day. I'm excited to be in Marshalltown for several reasons and planning on going to Taylor's Majorite myself, knowing what I know about Legionella. It's likely that people who got Legionella were exposed in Marshalltown, and we've already disinfected many of our core thoughts on how that got into the air. All of us are exposed to Legionella every day, and it's just an unlucky few who get really sick from it. I wouldn't cancel a plan to Marshalltown. I wouldn't not go out to eat at a restaurant or visit a local shop because of the outbreak that's happening now from Legionella, especially with as far as we've gotten in disinfection.
Thank you. And then one last thing, if we're suspecting it's cooling towers, as we go into the future, what preventative measures are done or testing measures done, or what agency is the one that regulates the testing of that to make sure that we don't have another cooling tower outbreak in the future, if that is what the case is?
Sure.
So I've been the one testing almost all of these cooling towers with some assistance just from the state. We have recommended remediation, so cleaning of those cooling towers as we've gone to test them, or if we weren't able to get testing that day, telling them, hey, if you have, some people contract them out to have certain cooling tower businesses that clean them or have chemicals that treat them. Some of them already have just systems in place. Some of them, because of this incident, have said we need to step up our cooling tower maintenance. Just kind of depends on each business. So because of this, I think we're moving forward to prevent this in the future and not hope it happens again, because it's very easily done because of the stagnant water that's hanging out in those cooling towers. And especially if you in Iowa, we tend to go hot and cold and from one week to another, and that produces it sometimes as well. If you have your cooling tower on and it sits stagnant for a couple days, or that gives perfect breeding ground for that bacteria to grow.
I'll add just one small thing. Anybody with a cooling tower should have a water management plan. And that is a best practice and a guideline set nationally. CDC has a lot of great information, and they have a toolkit on how you can begin creating a water management plan, but it's really a best practice at its core. We need local businesses to pay attention to that. We need them to establish a water management plan. For many, that requires hiring a contractor to help them ensure the system's disinfected regularly. And that's a main ask that we have now, that businesses in Marshalltown ensure they have a water management plan and that they're following it very closely.
Just, when do you expect the results of the tests back?
Results could come back as early as this week.
Okay.
Now, we might not get results back at all. If Legionella is going to grow, we might be able to see growth in 7 days. We're hitting 7 days toward the end of this week. Very frequently, even for a patient, we can find it on one test, but it doesn't grow. So I'm holding out hope we'll find growth, but I'm not going to count on it, and I might not expect it either.
Yeah. And you may have mentioned this, but I don't recall. Where's the testing being done at?
The State Hygienic Lab in Iowa City.
Okay.
That's all I have.
Okay. Joel?
Yeah, I'm the
Yeah.
mayor, so I got 5.
Do you want to, you have to, for
Or-
people
or-
online.
Or
you
right
have
here,
to-
Joel.
Get you mic'd up.
You can even come right here.
Thanks. Joel Greer, Mayor of Marshalltown. I had 5 interviews yesterday. I'm getting inundated by calls, emails, text messages, Facebook things, so I've had to do a lot of research. I talked to your department head yesterday. I appreciate the information I got from her about the connection with the meetings with the CDC. And Sydney was kind enough to talk to me too. I had talked to another person from your department yesterday. Can you reconcile a couple of questions I've got from different sources of information? Locally, our ER doctor, we have a wonderful ER department here. I mean, it's fantastic. It gets awards. Published something saying the tests of humans are done by urine, and you get the results within 6 to 12 hours, I think was what he said. But I understand too, some things are put in, the specimens were put in
Happy to help with
lab
that,
grown, and that takes 2 or 3 days.
Yep.
So I'm curious about that testing.
So let me give just an overview on Legionella testing. So for a person, there's 2 main different ways to test a person. You can look in the urine, and you can look in sputum. For people, we have tests that work really, really well at quickly identifying Legionella, if there's Legionella in that person. That's called a urinary antigen, and it's called a PCR test that's done on sputum. Both of those can provide quick identification. For a person, you also try to culture it, which takes time and growth. Those 2 tests will work on a person. For an environmental source like a cooling tower, our only option is culture. We have to try to grow this thing up.
And
So
that's
the test that we use on people, we have a lot of options. We only have one for environmental systems. For that one on environmental systems, it takes quite some time. And it's less frequently successful than the test we've developed for people.
And that one takes days, as I understand from the different
Correct.
sources.
On average, if it's going to grow, 7 days. Frequently, it won't.
On the cooling towers, about how many are left to check out or test in town? And if there are a lot, can we figure out how to get volunteers to help Sydney do the testing?
I have, let's see, just one business left to do today. If I remember correctly, yeah, just one. I did one this morning before the meeting. And then one this afternoon.
I think Sydney's done an excellent job finding them. CDC was able to layer on some extra help from some tools they had about finding them too. We think that we've likely found all of them, although we're still looking to make sure that we haven't missed one. We'll continue looking to make sure we haven't missed one. As of now, I don't think we have any bottlenecks in testing them, nor in recommending disinfection. The disinfection process can take some time, and outside of tucking in a few that we still need to test and continuing to make sure we haven't missed any, right now the biggest focus is those businesses finishing disinfection.
So Sydney, the one this afternoon, is that number 9 or is that 10? Or where are we on the number then?
I believe that'd be a 10.
That'd be a 10.
That'd be
yeah.
10, Okay,
Yep.
so 9 done as of this morning,
Yes, yes.
one more this afternoon
Yes.
scheduled.
Yep.
Okay,
Thankfully, the testing itself is not difficult. I have found myself on top of some roofs recently. But the testing itself is not difficult. It's the, of course, getting in contact with the right people to get to those cooling towers, because a lot of them are on top of high places or in secure areas as they should be. So that's been just a little bit of a hump, but it helps to be a Marshalltown local and grow up here to have those connections with people, so.
okay. Any other questions?
Where are the cooling towers?
On the tops of buildings. So sometimes they're on the side too, but I'm not sure if we've found any of them, and we don't have
That's not the question.
we don't have a specific location to give you. What we're doing is ensuring each one that is possibly the source is disinfected. So no smoking gun.
So the geographic areas, you're still referring to the north central part of Marshalltown?
Absolutely. So yeah, some of them are on tops of buildings, some of them are down behind buildings, some of them are on the side. Just depends on where those people decided to put them. Yeah,
So 10 different ones right now.
10 different ones. And some entities, may have more than one, so they could have two.
Yeah.
Just kind of depends on the size of the building
In the same general area?
in the same general area. Yep.
Okay. Okay.
They,
Mark?
that's not.
Mark?
I'm
do you
sorry.
wanna- Yeah.
Well, we're gonna make this hard.
Yeah.
How come you had to sit down?
Didn't get my question answered.
Oh, Lord.
You want to say your name and
Oh,
address?
got
Yeah.
it. Mark Wyatt, 2601 Ridge Road in Marshalltown. Hey, there's no way that this is, food chain oriented, right? Well, since packing plants use cooling towers to cool off what they do. I just remember way back years and years ago when they had an outbreak on a cruise ship.
Yeah.
And it came down to, but I didn't have that information. It was aerial or airborne vapor that was maybe the cause of it, because they kept looking at food stuff. And since we have such packing things around here, that's not an issue, right?
Any business with a cooling tower that's near where we're finding cases, we should be investigating.
But it doesn't affect the food chain.
The Legionella is not transmitted through eating or drinking.
Okay.
Yep.
I'll go back over there.
Okay. Anyone else? We appreciate all of Sydney's hard work on this and her efforts, heroic efforts going up on buildings and testing, and we appreciate, Doctor, your coming to inform us and brief us on what's happening and where we are in the process. So we look forward to further information
Certainly.
as you find out more.
Thankful
you.
to be here.
Thank you.
Thank you.
Thank you.
All right. We will continue with the agenda, moving to item number 6, the consent agenda, which includes approving previous session minutes from August 27th, approving claims as audited, personnel changes, new hire Delaney Henley for the Sheriff's Office jailer, $25.32 per hour, to start on or after September 15, 2025. New hire Caden Prisky, Sheriff's Office jailer, $24.36 per hour, to start on or after September 15, 2025. Status change, Jared Callahan, secondary roads, truck driver 2 to truck driver 3, $32.77 per hour, effective September 13, 2025. Status change, Donnie Box III, secondary roads, truck driver 3 to, I get, to what?
BOP.
BOP, yeah, I guess that stands for
it is.
something. BOP 2 at $32.50 per hour. November 4th, 2025, city school election hires. Hire precinct election officials, elections rate of pay $12 per hour, effective November 4th only, 11 polling locations. Hire precinct election official chairs, election rate of pay $14 per hour, effective November 4th only, 11 polling locations. Hire up to 6 additional full-time equivalent election absentee voting workers. Rate of pay $12 per hour, effective October 1st or later. Hire election special precinct board up to 12 people. Elections rate of pay $12 per hour, effective November 3rd through November 18th. Item 6D, file manure management plans, MDH finishers, number 62120 at 1671 140th Street, Union, signed with no changes. Norman Pork LLC, number 59367, 1105 Fairman Avenue, Union, signed with no changes. Hib site, number 58019, at 2541 280th Street, Marshalltown, signed with no changes, signed with changes. Item number 6E, approve election of new members to the IMWCA Board of Trustees, 3-year terms ending 2028, and authorize the chair to sign. And that is the end of the consent agenda.
I move that we approve today's consent agenda.
I will second.
Okay, any further discussion? All right, roll call vote, please.
Goodman,
Yes?
Hibbs,
Yes?
Kyle,
Yes.
One note on the election officials, it's full-time equivalency. Many times we have part-timers, that may be 2 people filling, or maybe 3, filling one full-time job down at the election center. They retire for a reason. They said sometimes they don't want to work full-time, so just to point that out.
Thank you. All right, moving on to item number 8, approve memorandum of understanding for YSS of Marshall County application for opioid settlement funds, and authorize the chair to sign. Jordan, do you have comments on this?
Morning again, Jordan Gaffney, Marshall County Attorney. Given that it's National Recovery Month, it's kind of extra exciting to have this on your agenda for today. So several years ago, YSS, and David Hicks is here, they partnered with the Marshalltown Police Department and started Impact, which was a program to send out police officers with social workers to help folks in the community. And the program has been successful in directing people out of the criminal justice system before they would enter, and in just helping folks in the community. And it's received a lot of positive feedbacks from law enforcement, from my staff. We are very thankful for Impact and folks in the community. And as you also know, Marshall County has received a few $100,000 from the National Opioid Settlements, and will continue to receive funding for the next 14 to 16 years. And so we have, and over the course of that process, David Hicks reached out to me actually several years ago and asked about, could we use some of this funding to expand the Impact program? Would that be something that we could do? And I just want to say thank you to David for your patience and your perseverance in that process, because it's been a long process getting to this point in 2025 to have this agreement before you guys. So this agreement, what it would do is it would expand the Impact program, not just in the city of Marshalltown, but county-wide, and would give access to the sheriff's office to have a deputy and a social worker respond to events in the county, using non-taxpayer dollars, using the funds from those opioid settlements. So the agreement before you today is for a total of $125,000, $125,031, I should say. It's a 1-year agreement. So if we move forward with the agreement, I think it would be wise to think about the longevity of the program and how long we would want it to run, assuming it's successful in YSS and the sheriff's office would wish to continue. This program's opioid abatement purposes, to qualify for funding under the national opioid settlements, we have to have an opioid abatement purpose. This would be geared towards prevention of opioid abuse. That would be the primary goal, and remediation on the back end if someone were to have an overdose or develop a substance use disorder. So there's twofold, and there's different ways that the program could apply and would qualify for funding. And just for your information, the county currently sits at just about, actually just a little over $430,000 received already in opioid settlement funding. So we do have an opportunity, and we do have the funding to really make this happen, and project it to happen for 3 years or so. I drafted the agreement that's before you guys. If you have any questions on it or on the program, you can let me know. But this is a really unique opportunity, and I'm just the conduit really that will kind of help put this partnership together for YSS, the sheriff's office, and the police department would be involved in it too. So this would be a three-way partnership, and I think it would help folks in Marshall County.
Jordan, I don't know if you answer this question or if David comes up to answer, but does this allow them to hire an additional staff person to make it available for the sheriff's department's access, or are they doing that with current staff?
They would have to add staff.
Okay.
Yeah. And that's the biggest thing, having somebody who's the boots on the grounds to make this happen and respond to calls and be available. And expansion is only able to happen if they're able to have that additional person available. Do you want to add anything, David?
Yeah, come on.
Sure.
David Hicks, Director of YSS of Marshall County. Yes, we would hire a third impact advocate. What we've done with city impact dollars for the last 5 years, providing 2 full-time community advocates, Susie Reed being one of them over there, Tiffany Vito being the other. Each year we survey the Marshalltown Police Department on the effectiveness of impact, and we always allow them feedback on their concerns or their needs, and the most consistent complaint is there's just not enough advocates to cover the amount of time. So right now we're covering, could be 2 till midnight. There's some days during the week where we do double shifts, but this would allow a third impact advocate to come on board to cover maybe some more daytime shifts, maybe later in the night, earlier in the morning. So having 3, certainly at least 16, 18 hours a day, I think is certainly doable. And we've mocked through some schedules to make that happen.
And so if a call comes from the sheriff's department there during those hours, they would be a priority to get assistance?
They would receive the same priority as any call coming
Okay.
in. We would triage that. As it stands now, an officer is sent out initially to respond, to establish some safety and the appropriateness, and then impact advocates then follow. So Susie and Tiffany reported to City Council on Monday night that we've, so far this year, 100% of the calls impact has responded to has allowed the officer to return back out into the field. We track that data. That was one of the things we wanted to concentrate on the most, is just getting officers back into the field to do what they do best.
Mm-hmm.
Thank you for your work on this. I know when we talked at, I think your budget meeting, Jordan, was, these opioid funds, that there was all these funds coming in, but there's a very specific, tight of what we could use these funds for. And so thanks for working together to come up for a good reason to use these funds. And hopefully this is a good partnership going forward. I like that we're doing the 1 year to determine how this is working and what the future of it is. Of course, when you look at using any kind of we're looking at one-time funds, obviously 15, 16 years, we'll want to, I don't know if I'll still be here in 16 years, but at that point, we wouldn't want to know what is our direction that we phase at that point when we're using these kind of funds, but we're obviously not at that decision-making time now, but that's something to have in mind as we go forward to make sure how do we use these funds appropriately now and how we can have longevity into the future.
Yeah, there's been agencies all over the country who've used these opioid dollars to start their co-responder programs. So we're lucky we have a head start in what we already do, so the framework is already in place. And while these are opioid dollars, we're going to be responding to far more cases of mental health, family conflict, well beyond opioids. We may be just seeing symptoms of an opioid addiction, but the services we provide will be far beyond opioid addiction, mental health, homelessness, family conflict, juvenile issues, domestic violence, and that's what we currently track.
And those are all prevention oriented.
A good use of these funds. So
Yes, yeah.
Thank you for your patience.
Yeah, long time coming.
Thank you.
I would entertain a motion.
I'll make a motion to approve the opioid settlement agreement with, is it Purdue
Item
Pharma?
number 8, yeah.
Oh my gosh, I'm ahead.
Yeah, item number 8.
I'm on 8, sorry. The memorandum, the MOU for YSS of Marshall County application of opioid settlement funds, and authorize the chair to sign.
I'll second that.
Any further discussion? Roll call vote, please.
Goodman,
Yes?
Hibbs,
Yes?
Heil,
Yes.
Okay.
I might need those bifocals they told me at my eye appointment this morning. My goodness.
Join the club. Yeah. Okay. Item number 9, approve opioid litigation settlement agreements and authorize the county attorney to sign. So Jordan, you're back up here.
Stacked your guys' agenda today. All right, so we've already received funding from a number of settlements. A couple other groups of defendants have entered into settlements as well. The Purdue-Sackler family, that should be a substantial settlement, and Iowa stands to receive, they estimate over the course of 16 years, around $23 million for the state of Iowa. That'll be distributed throughout the state.
Jordan, do you know what's the formula for distribution? How do they decide how much each county gets?
They have, it's in one of the exhibits, they have figured out the percentage that gets distributed out to each state, and then the state figures out the percentage for each county.
Okay.
The counties that participated in the litigation get a little bit extra. Marshall County was not a participating, so we don't get as much, but we've already received a substantial amount of funding through that. So this is good news, and really I think represents kind of a once in a generation opportunity to get these funds and put them to use here in Marshall County for folks who need help. And we just kind of set a plan in motion with the impact program expansion to do that. So I'm excited about that. The only thing I could really think to compare it to would be the tobacco litigation from 30-ish years ago. That's the only thing I could really think to compare it to. So the Purdue Pharma Sackler family settlement, that one's a little bit more expansive because it involves a Chapter 11 restructuring of the company and their debt. The other one, the secondary manufacturers, that one actually involves 8 different defendants, smaller manufacturers, comparatively smaller, I guess I would say, who have been grouped in to these particular settlements. And so there are 8 different agreements that are kind of looped into these. And it's not entirely clear what sort of funding Iowa will receive from these. We'll get funding through the state from these. It's not as set in stone or as clear as it is under the Purdue-Sackler settlements. But I would recommend that the county would participate because this allows us to use non-taxpayer dollars to try to help folks here and make a difference for folks here in Marshall County. It's just a fantastic opportunity through what is truly a tragedy that has happened. So we can turn something horrible into something good. I think we should do that. I think that's a good thing to do.
Does this funding have the same guidelines for use as the
Yes.
previous?
Yeah,
Same guidelines?
the guidelines are the same. The Exhibit E for the guidelines for how you have to apply it are the same. So we don't have different sets of rules, which is nice.
That's helpful, yeah.
Yeah.
Questions for Jordan? Okay. Thank you, Jordan.
Thank you.
Do we have a motion?
I move that we approve the opioid litigation settlement agreements and authorize the county attorney to sign.
Okay, so we'll do the first motion, the agreement with Purdue Pharma and the Sackler family, and authorize the county attorney to sign. So for that motion, any further discussion?
We need a official second.
Yeah, we
I'll
need a
second
second.
that.
Okay, yep. Roll call vote, please.
Goodman,
Yes?
Hibbs,
Yes.
Heil,
Yes.
Okay, do you want to do the second motion then, Kevin?
Yes, I'll move that to approve the opioid settlement agreements with secondary manufacturers and authorize the county attorney to sign.
I'll second that as well.
Okay, roll call vote, please.
Goodman,
Yes?
Hibbs,
Yes.
Heil,
Yes.
Okay. Item number 10, approve the purchase of 2025 Chevy Silverado 2500 HD four-wheel drive crew cab LT from Carl Automotive Group in Des Moines for $55,706.80. I believe we have Paul online. Is that right, James?
I'm here.
Okay.
Yes.
Paul, do you want to speak to this?
Yes, we can.
Sure. This is a just a replacement of an older pickup that we're taking out of service, and Carl Automotive does have this unit in stock, so we will be able to get it this week or next week. We'll pay for that out of our current budget.
Any other questions or comments for Paul?
No.
Do you think we can get by 1 year without buying a new pickup with the road conditions that we've experienced this year?
I'm not making any guarantees. You know, we're back into a spot with our, we're trying to get a tandem axle, and we are back into over a year out to get a tandem axle chassis from Volvo. So we can't even get one this fiscal year, even though we were hoping to. So it's not sure what the hang up is there. Actually, the biggest issue we've got there too is once we get the chassis, we've got to get the dump body and everything built. And it's, there's getting to be quite a lag on that.
Any other questions or comments for Paul?
All right, I'll make the motion to purchase the 2025 Chevrolet Silverado 2500 HD four-wheel drive crew cab LT from Carl Automotive Group in Des Moines for $55,706.80.
I'll second that.
Okay, any other discussion, comments? Roll call vote, please.
Goodman,
No.
Hibbs,
Yes.
Heil,
Yes.
Okay, moving on to item number 11. Approve the contract between Marshall County and Garland Construction for the Marshall County Sheriff's Office and Jail Phase 1 renovation. Lucas, do you want to speak to this item?
So this is the contract that OPN's written up for us with our agreement to do our ARPA project work at the sheriff's office and jail. I've reviewed it, Jordan's reviewed it, Joel's reviewed it, and it'd be my recommendation to move forward. All the numbers check out. If you look at it a little bit, there's a section 253000 that's for $88,190. That's basically allotment that we built in to have our building automation tie into the new rooftop unit. So it was a set aside number that the contractors knew they had to put in there. So that's the only thing that stands out a little bit.
Yeah,
And then
I
there's-
like the information that, they cannot change the superintendent without our approval.
Yeah,
So
yeah,
Our project manager will be consistent
Yep.
unless we say otherwise.
Yeah, AIA contracts are really nice. You have some pretty clear definitions on whose responsibilities are what, and some of the processes and changing those things are spelled out pretty well. So, any questions?
Questions?
No, thanks for work on this.
Awesome.
Yeah.
Next step.
I move that we approve the contract between Marshall County and Garling Construction for the Marshall County Sheriff's Office and Jail Phase 1 renovation.
And I'll second.
Any further discussion?
Long overdue.
Roll call vote, please.
Goodman,
Yes?
Hibbs,
Yes.
Kyle,
Yes.
Okay, moving on to item number 12, public forum. This is time set aside for the public to make comments on the topics of county business other than those listed on the agenda. No action will be taken on any of these topics brought up in the public forum.
Mark Wyant, 2601 Ridge Road. I'm kind of confused as to the process of coming up and saying stuff about those roads all the time, and I've asked for communication about it before, and it just doesn't happen. So I don't know where that leaves anything. I mean, if I'm just supposed to hush up and not do this anymore, but the last time I was here, following that, I've seen once that the road grader came out and it looked like somebody dumped aggregate on the road and had smoothed out one or filled in a couple of ruts up on one side of the hill to the west of us. But you could still, I know it's an exaggeration, but there's ruts in that road that you could change oil in. I mean, there's leading over to the neighbor's house at 2602, leading up on his curbside or his roadside edge where his grasses grow up out of there. He's got decorative grasses grow out of there. That there's ruts in there that are a good 18 to 24 inches deep now. And as you're coming westbound from Ridge Road, there's spots where you have to pay attention. Well, you should always pay attention, but where you really have to pay attention that when somebody's coming the other way, you don't get too far off to the right because those ruts are going to suck you right into the ditch. I mean, they're just nasty. And I understand there's limitations to what people can do, okay? But it seems like nobody's even going for the limitations. It just kind of is what it is, and maybe the old guy will die off and we won't have to worry about it anymore to have him come up and complain about it. But because I understand that also that, there's younger families moving out there now. So as younger families come out, the time of the meeting here, being in the morning hours, it's going to be less of a chance of anybody that's bothering them to come out and do it. You leave to the old retired guy to show up. And the other fellow that was going to come out with me I called him to remind him, and he just started doing a burn out behind his barn. So there was no leaving that go without getting in trouble for it. But it's all coming down to just some type of communication. But it's not y'all. It's coming. But I need the people that are in charge of like with Paul and the group that are in charge of maintaining the road, which is saying something to somebody. Letting us in on that this is being done or this was done. How's this? Is this working out, or this is what we're planning on doing? But there needs to be some light at the end of the tunnel here, or it's just, I'm wasting your time, I'm wasting my time. And I'd rather not. I just want the thing to be the corner by my house gets worse and worse and worse. It's eating out into the road a good 18 inches, 2 feet. you know, the rutting and divoting stuff from the washout coming through it. And it hasn't been an issue of rain here for a while. You know, we've been pretty good without the rain. So I don't want to get into the zone of frustration, okay? But we're kind of really quickly approaching that to where you just wonder why bother if nothing's going to be communicated or done.
Paul, do you have some communication for Mark?
I know he's at training, so I don't know if he dropped off.
No, I was trying to talk to you with my mute on.
Okay.
Doesn't work. Hey, we do want to make things better out there on that stretch, but the bottom line is this road is open. It's not ready for the fair, but it's passable right now. And we have harvest beginning in Marshall County, and we have several places where we have roads that are closed, and they are really impeding harvest for a lot of our farming community. And if we've got closures, we really have to repair those before we can work on just making, you know, an edge rut that it's a speed limit 25 road. We do want to make it safe and passable, but currently I believe it is passable. If that's not the case, then we really need to talk more. I also want to let you know that I return every phone call that I get from Mark Wyant. I do not ignore any of his messages. But I'm really going to prioritize our closures that we are repairing. We've got a couple right now. Yes, we haven't had to compete with rain lately, but we are still fixing things from the wettest July that we've had since 1993. And there's areas where we are having to regrade short sections of Rock Road just to make sure that ag traffic can get through.
So Paul, I understand that. Do you have a timeline on when some additional grading might be able to be done?
I really don't, because we are going to get, we've got a spot that we're working on down on 330th right now, and it's, you know, far southwest part of the county, so it's an area that not very many people go through. And then the other one that we're working on is going to be 250th Street west of 146. And that's just, it's a situation where there's no ditches left, and it's, you know, the ditches have silted in over the decades of not getting ditches cleaned. And that one is going to also be something we're going to try to get completed here this fall. We're going to keep working on these projects until we have to switch over to snow mode. So the longer the weather waits, the more we can get done.
Okay, with the traffic that's happening out on the road right now, it's passable as long as you can stay more towards the middle, or that that you pay really close attention to where you're doing, if you're doing oncoming traffic on the left side of the road where you're at. And with the younger drivers that are getting out and about in the way, they had some young woman come over the top of the hill the other day, dead center of the hill. She's crowning the hill. And I mean, they drive in the center to stay away from that stuff. But if you go over to the right, you know, to get out of the way, you get sucked into a ditch. And it's just, again, I understand there's limitations to what people can do, but it's just not working, is the thing. You know, if we to say that you need to slow down, or and Sheriff would agree with me on this, 25, that doesn't mean that's what they're driving on it, you know. And the Sheriff's Department, the guys are busy. They don't need to be sitting out on my road looking at somebody running up the road, you know, with, going over that 25 speed limit. It can be a suggestion that that's how fast they go, but we all know that that's not what happens. And again, as we get younger, younger families are moving out to where we are. And so with younger families come younger drivers. And they just, that doesn't work. you know, with the go slow, so we'll make it passable thing. And I've never said that, you know, Paul doesn't call me back if I call, just that as things are being done, I just wouldn't mind every once in a while, because I'm old, I'm retired, I answer my phone. And if, you know, if somebody had something to pass along that, hey, this is what we're doing, just kind of quell it. And I know I'm doing the squeaky wheel thing, but throw some grease on the old squeaky wheel so he knows what's going on. And I think we'd be miles and miles ahead on it. Okay?
We are going to have to make some changes. That hilltop issue, Mark, that you're talking about, is that to the west of you? The hilltop just to the west of, on 260th?
Yeah, yes.
That problem and that bad rut right there is completely being caused by a paved driveway that drains out onto the road. Now, we can make some changes there, and we are going to, but it's gonna likely involve removal of part of that guy's paved driveway and replacing it with rock. We're gonna take 12 or 15 feet of his driveway out, probably back to the right-of-way line, and reshape his driveway and make that driveway that is draining down currently right to our road, it's gonna drain down into the ditch. And that's what's causing the problem at those mailboxes completely, because it's water coming off the top of the hill, and it's coming out of a driveway that's, you know, the size of a basketball court.
Yep, I understand that. It's whatever makes the
But
place
that,
better.
we need to work, we're gonna have to work on the limits of our right of way and get the drains back in the ditch. And we can't have this draining right down the edge of the road, because every time we get a half inch of rain, it makes a new rut.
All right. All right, thanks. That's all I got.
Okay.
Okay.
Thank you, Mark.
Thanks.
Thanks, Mark.
Blaze Ware, Marshall County Assessor. I am being notified that our countywide reappraisal project will be starting most likely in early November. It sounds like it'll be starting with the residential, potentially Marshalltown, and then in the next spring is when everything will pick up with the rest of the residential and the other classifications in the county. So I just wanted to give a preliminary update now until I get more information from our vendor Vanguard, until I can get press releases out, letters out, anything like that that I could potentially do to help.
Okay.
Great,
Thank you.
thanks, Blaze.
Thanks, Blaze.
Anyone else? All right, we'll be moving on to item number 13, which is a closed session. Per Iowa Code 21.51C, regarding pending litigation.
All right, I'll make that motion to enter into closed session pursuant to 21.3 subsection 1, paragraph C of the Code of Iowa to discuss strategy with counsel in matters where litigation is imminent, where its disclosure would be likely to prejudice or disadvantage the county in that litigation. Marshall County has an attorney-client relationship with the Office of the Marshall County Attorney and Allers and Cooney at 10:08 a.m.
I'll second that.
Okay, roll call vote, please.
Goodman,
Yes.
Hibbs,
Yes.
Heil,
Yes.
Okay.
Thank you. Thanks.
Yeah.
Thanks, Mark.